Hi, my name is Shavon Wigfall, and I will be discussing my senior project that I did on safety. Don't forget to run with a purpose. And patient safety is an absolute priority in healthcare because it has a direct implications regarding outcomes in patients and hospital quality overall. This project was to enhance safety through organized rounding, an action that offers frequent observation of fall risk, infection prevention, and proper use of PPE. By introducing a compliance checklist in an acute inpatient unit, my mentor and I reminded staff to remain in compliance with established practices in safety while educating patients regarding responsibility in fall prevention and infection avoidance. Enhanced patient care is not only achieved by organized rounding, yet this practice is to encourage accountability in healthcare workers. This project was based off questionnaire audits, training sessions, and educating patients to encourage improve safety in the future. We develop strengths as well as areas in development through observation and feedback by workers. This project ultimately desired to prevent hospital-acquired infections, prevent patient falls, and encourage a culture in hospital practices regarding safety. The goal in this project was to mitigate patient risk by introducing organized rounds. We attempted to gain increased compliance among staff by focusing on regular practices related to safety. One of the most vital aims was to enhance compliance by staff and following patient safety practices. This was done by introducing targeted training sessions, regular audits, and symptomatic checklists to encourage optimum practices. Another priority was educating patients. Patients had to be educated regarding fall prevention and infection control in order to take an active part in ensuring their own safety. Rounds included patient education to inform patients about practices related to safety. In conclusion, audits and surveys were employed to establish effectiveness in these interventions. We gather data through both structured observation and staff responses in order to measure changes in compliance. These three prolonged processes of training, educating, and evaluation offer an overall balance methodology in minimizing hospital-acquired occurrences and ensuring increased patient safety. The efficiency of this project was confirmed by multiple measurable outcomes. One was increased compliance among staff. From introducing organized rounding, 95% of staff reported increased compliances with safe practices. This included increased regular checking of fall prevention practices, cleanliness of hands, and wearing proper PPE. Patient education was an integral part in making the project succeed. Nurses actively interacted with patients to educate them regarding fall prevention and infection control practices. Patients were asked about fall prevention knowledge to reinforce key messages regarding safety. The outcome of the questionnaire audit further confirmed the efficiency of these practices, encouraging an outstanding 91% improved hand hygiene and PPE practice following training sessions. This is an indication of the efficiency of symptomatic rounding, and recommendations to secure increased future success include an expanded sample number of electronic tracking systems. This should provide improved data and increase long-term compliances. In an attempt to achieve this target, several key steps were put in place. So one was hourly rounding by nursing staff to monitor fall risk factors, hand hygienic practice, and appropriate wearing of PPE. Institutionalizing these checks in workflow improved consistency among nursing staff and following guidelines. So structured checklists and survey tools were used by us as well. These tools produce measurable results in accordance with safety standards and enabling areas to be located where changes needed to be instituted. Repeated questionnaire audits ensure the best practices continue to be empathized. And compliance was sustainably increased through training and practical training in wearing and removing PPE, and hand hygiene and effective prevention was carried out among staff. So we increased awareness and provided compliance by engaging the staff through an active training. And feedback was also essential, and survey showed that 95% of staff found that education materials clear, that the education materials was clear and useful, and confirming that our training strategies were effective and well received. So we implemented specific strategies to address key safety concerns, like fall prevention was a primary focus. So the staff ensured that the bed alarms were set, yellow armbands were worn, and non-ski socks were provided to high-risk patients. So this simply but effective measure helped reduce fall risk. And another area where emphasized was place was in hand cleanliness. So we did audits for entering and exiting patient rooms, and this reduced infection transmission. That was a very problematic in on our unit. And compliance reminders were also used to reinforce appropriate hand cleanliness practices. And proper donning and dolphin methods were known for this by the staff to training as well for proper PPE. Their awareness was confirmed by testing to support infection control practices as well in general, and these methods produce greater compliance with safety practices. So the outcome of my project revealed clear improvement in both compliances among staff and in patient safety. Among these was improved compliance in rounds of 95%. So improved compliance and symptomatic steps and process was achieved by nurses and following doing providing better care to patients. And another key achievement was improved awareness among workers. On completion of training, 91% of the nurses reported greater awareness regarding infection control practices. And this also require prevention of hospital-acquired infection and to have a healthier working environment, both for patients and in the staff. And the training was also effective since 100% of workers confirmed that training material was actionable and clear. So this is the indicator that the symptomatic training was helpful in providing improved patient safety. And so the project was implication of nursing practice, clinical practice, and healthcare informatics. So the practices increased fall prevention compliance rates, infection prevention compliance rates, and compliance rates have been improved throughout the unit and among patients. So practice of the project highlighted the importance of continuous training, and symptomatic training sessions kept the staff all informed, and the status is respect to practice and ensuring patient safety. And any future training programs can leverage these practices by including authentic rural audit outcomes to inform better outcomes. So I'll say that this experience was rich in lifelong learning to both the myself and the staff. Professionally, leadership and audit skills were enhanced, and the staff was has become increasingly active in ensuring patient safety to developing an anticipatory attitude towards management of risk. So I'll say continuing education is central in healthcare. And this project was heavily emphasized in evidence-based practice. And do symptomatic rounds practice consistently and adhering to standards of safety was maintained. And principles learned through these practices can be used in future nursing careers to guide safe practices in patients and to further new nurses as well that's coming to that's coming along. And the key point is that the symptomatic round is not just an everyday practice, it is an invaluable aid to ensuring high quality care. And when healthcare professionals reinforce best practice every day through repeated rounds, improved outcomes in patients can be sustained in the long term. And as a nurse, lifelong learning is integral to provision of safe and high quality care. This experience has further developed my skills in analyzing clinical issues and making interventions and measuring the results. And this has also further entrenched my realization that small adjustments in daily practice will yield dramatic improvements in patient safety. And I thank you all for taking time to listen to my experience. Thank you. Have a good one.